Stewart says is what really matters in terms of inequalities is inequalities between culturally defined groups of people. And she calls these horizontal inequalities. Okay? Inequalities between groups. And she says that where inequalities in accesses to resources and power coincide with cultural differences, culture can become a powerful mobilizing agent leading to political disturbance. And this is where I get to my final thing, which is about the intersection between economic issues and broader ones, like ethnicity, religion, so on. She points to all kinds of different sources of different group differentiation and examples of where conflicts have been fought on that basis: religion, class, ethnicity, clans and factions, for example. But the most important point that she's making is that it's the differentiation in access to different resources by these groups which really matters. And the question for you, I'm trying to be practical now, because I'm trying to give you a lever into understanding how you could prevent underlying causes of conflict, yeah? If you accept the horizontal inequalities theory, you could argue that concentrating on inequalities in ownership of land, for example, or the distribution of natural resources, or aid, or how incomes are distributed, or how social services are distributed, especially education and health, are going to be key in order to prevent violent conflict. But you must look at how they are distributed amongst groups, not amongst individuals. That's the critical point. I've only got 3 minutes. I was going to give you 2 examples of this, so
do that.
Is that okay?
Yeah, of course.
All right. Well, these again, they're hair examples. So here we have the example of Sri Lanka, and I don't know how many of you are familiar with the Sri Lankan conflict, but during British colonial rule, the minority Tamil group was systematically favoured by the British. As in many countries, the British pursued a policy of divide and rule by favouring minorities within the population. And after independence, the Sinhalese majority government attempted to correct some of the favour that had been bestowed on the Tamil population by the British. And these bar charts show, over the 1960s, 1970s and 1980s, shifts in the ratios of, first of all, Tamil income to Sinhalese income, which ended up about equal in the 1980s, yes, very moderate correction there. In fact, people were pretty equally off. Civil service employment, share of university admissions, and science admissions. And it's actually these ones which were possibly most important in triggering conflict in Sri Lanka, because the dramatic reduction, civil service has basically been run by Tamils. And they were chucked out of the civil service. They were denied access to teacher training colleges. There's an astonishing statistic from 1977. I think there was only one Tamil succeeded in the civil service examinations that year. This caused outrage amongst the minority Tamil community and was, along with many other factors, and the very, very harsh attempt by the Sinhalese Buddhist government to correct previous injustices, was one of the triggers for the civil war beginning in the 1980s and the call for Tamil Elam, an ethnically pure Tamil homeland. Okay? So the attempt to correct a horizontal inequality can be quite dangerous, yeah? But it can work, as the case of Malaysia shows. Malaysia had a similar situation with minority Chinese doing relatively better than the majority Malay population, the Bumiputra. And you can see that ratio of household income from indigenous Malay to the Chinese is still relatively low. But over time, the indigenous Malay population have been doing better. And that's due to Malaysia's new economic policy, which was instituted at the end of the 1960s, primarily as a result of race riots in that period of time. There was a lot of political agitation around this. But there has not been the outbreak of civil conflict in Malaysia that there has been in Sri Lanka, even though the same type of correction of horizontal inequalities has occurred. Positive discrimination worked in this case. How was it done? Well, it was handled carefully. It was done in critical spheres, especially involving the public sector. We can talk more about democratisation in a minute. Strong human rights provisions to protect all groups are ideal. This wasn't necessarily done in the Malaysian case. Requirements that each group participate in government, positive discrimination allocations to different groups, decentralisation seems to be important as well, and membership of major groups in all levels of the civil service, army and police. It's worth noting, if we're going back to the external influences, that aid ignores horizontal inequalities normally. It just doesn't address groups. Aid is given to create economic growth, largely, or it's to increase human development of individuals, not of groups. Yeah? And the final point that Francis Stewart notes is that actually maybe one of the things we also need to be thinking about is not just inequalities within countries, but inequalities between countries. And she was initially writing this work in 2001. She points out rightly, I think, that it's fairly easy for global terrorist leaders like bin Laden to mobilise large elements of the Muslim world against the non-Muslim world when there are vast inequalities between rich and poor countries. What she has also noted in a later paper is that in many countries it is certainly the case that Muslims are discriminated against within countries. There's enough discrimination occurring that it makes it even easier for people like bin Laden to draw on that history. So both the existence of inequalities between countries and within countries increases the likelihood of extremist ideologies gaining a hold. But it's the crucial interaction with the group which is important here. Yeah? And finally, the role of the health sector. I think this is really incredibly difficult. I don't necessarily see a role for doctors and nurses, per se, in this. But I think that's an incredibly narrow way of seeing the health sector. I see myself as part of the health sector. I'm not a medical professional. But I think it's incredibly fascinating. You know, health is determined itself by many things beyond the health sector. Underlying causes of war, similarly. We have to find ways of joining up different sectors. I think it's also the case that healthcare is not the essential sector to address when you're addressing horizontal inequalities. It's much more likely to be education and other aspects of the public service. Should that stop us, as people primarily concerned with health, worrying about horizontal inequalities? No. And it may be that we need to rethink our intervention in this area by broadening focus to look at the idea of human security, which encompasses more than health, more than arms, but includes both of those as well. Thanks very much.